Hey folks, it's Friday, July 23rd. I think last week I gave you the wrong date. It sort of blurs together sometimes and I can't keep them straight. But anyway, this will be sort of quick today. I know you're laughing out there, but I really will be. Because mainly I want you to go back and look at the last week's video. I said a lot then. Um, and there's not much that has changed. Well, in a manner of speaking, cases are doubling almost every week, all driven by the new variants, mostly Delta. But there's other variants that are on the way too. Um, we've got to buckle up, folks. This is a really serious time. I know we spent almost a month and things were really nice and pleasant and we thought the pandemic was gone. But in the words from Department of Health, this is now a pandemic of the unvaccinated. And I know you're out there. I know that there are many of you, your friends, your families, that are not vaccinated. You are at exceedingly high risk. This new variant is not going down easy. People are sicker. People are getting in the hospital. Cases are rising and even deaths. This week alone, in our own monoclonal antibody infusion area over in Suite B at Hartsville, as of this morning, and it's probably increased even since then, we've had 50, mind you, 50 cases. They are running ragged over there. And it's so discouraging. Folks that don't need to be that sick. And yeah, we've even had a death, or maybe even more that I don't know about. Um, so yeah, this is a tough time. I'm not going to go into near as much detail as I did last week. Last week I also gave some examples of trying to dispel all of this misinformation that is out there. I'm not a clinician. I'm not your doctor. But please, please, talk with someone. If you are listening to this and you or someone you know and love and care about is not vaccinated, get the information. We've had a long period of time, lots of people that have been vaccinated, and we know the safety of it as compared to the risk of COVID, the risk of dying, the risk of being hospitalized, being in the ICU, and even worse, having long-term impacts. So, enough of that. I want to remind everybody that we have that really cool new communication tool that's gone out, the news alert memos that are being placed either in your hands or on your desk. We understand email is not always a good tool to communicate with you, and we recognize that, but we're hoping that this new tool, now we're not going to swamp you with them. There's only been 3 that have gone out so far to General Care South. There has been one additional one that's gone out to providers only, but these are going to be very important messages, information, and alerts that we need to get to you. So please pay attention when you see them put in your hand or on your desk or your workstation. We hope that this proves to be a very impactful and very effective tool. Um, because of the alarming increase in the COVID cases, I think I'd mentioned to y'all before that we were really trying everything that we could to develop a face-to-face staff meeting sometime around the September area. Folks, we have just tabled that. It is not the time to be thinking about that. Not with the cases on the rise. And frankly, it takes us a pretty good period of time to prepare for this. It's not easy. We do a lot of preparatory work and getting ready for it and so forth, and we just finally decided that we probably should not do it. It would not be wise. So I'm hoping, and we do have reservations at SIMT for our December meeting, and I'm really praying that that will be possible and that will work out. But if we can't get this pandemic of the unvaccinated in control, we may be facing a winter ahead of us that will be as concerning as this summer is turning out to be. Please, please stay safe. Please be careful. And please spread the word. This is a pandemic of the unvaccinated. Please help your friends, your neighbors, and yourself learn more about this vaccination and understand that it's safe, and to make the decision. Please get vaccinated. Bye, y'all.